I broke my neck about 40 years ago and I had a cervical fusion of the 5th and 6th vertebrae.
Right.
I was advised that there may be a problem with vertebrae either side of that at some time in the future. I forgot about that and played about 150 games of Aussie rules. 3 years ago I was diagnosed with a pinched nerve of the vertebrae, the 4th and 5th vertebrae. I had an MRI scan and that was confirmed, and I was booked in for another fusion of the 4th and 5th vertebrae. A friend of mine suggested I try his E-cell, and I tried it for a fortnight and the pain diminished. So I actually cancelled the operation, which I'd actually signed for, and I purchased an E-cell, and I have been using that for an hour and a half every day since then. The pain has totally gone away. I ride a bike, I do between 30 and 60 k's a day on my bike, and I play golf about 3 days a week. The rest of the time, my occupation, I'm a town planner and a project manager, and most of the time is spent stationary, or my job is quite sedentary, but my neck is put in a position where I'm at the desk or at my computer. So I don't think any of the things that I do are very good for my neck. However, the E-cell has taken the pain totally away. So I'm very happy to pass that message on to anyone else.
Thank you very much, Ian. That's great.
It is a well-known fact that exercise is essential to keeping fit and healthy. Without it, our bodies would degenerate to the point of being dysfunctional. Exercise is also a key factor in accelerating the healing process. Based in Western Australia, but spanning 3 continents, a team of eminent specialists in orthopedics, sports and skeletal medicine decided to expand on NASA's scientific research into overcoming muscle degeneration due to weightlessness in space. Taking a different approach, the team looked at exactly what induces the body to replicate cells. The E-cell is the result of 10 years of development, testing and fine-tuning.
E-cell is an essential family medical tool. It gives parents and individuals an ability to control and participate in the biological process of recovery.
I can't speak highly enough of it, and I'm not one to sort of pretend or rave about something that's not really true. I can't believe it's happened, but I'm so grateful that they produced this.
I was meant to be limping for about 2 weeks, but I was walking after 1 week.
It has made a significant improvement in my life, and I would say the pain has gone down by 80 to 90%.
There is no drugs, there is no pounding or pushing, there is no incisions of any kind, and that makes it of great value to me.
You can use it I can use it at the desk, use it lying down on the couch, use it on a bus on a road trip, use it wherever you want, and it's basically just put it on, strap it on and press the button. It's simple.
Small enough to fit in the palm of your hand, this bioelectronic medical device uses smart therapy cards which look exactly like the SIM card in your mobile phone. Each card contains a program of information for specific areas of the body, providing pain relief for a range of musculoskeletal health disorders for people of all ages. There are 12 specific therapy cards: mid and lower back, neck, shoulder, hip, elbow, wrist, knee, ankle, bone, together with an osteoarthritis and vascular card. Furthermore, each of these cards not only holds information pertaining to the specific area of the body, but contains a coded communication language which replicates the body's own natural healing processes.
I've been training for many, many years, and every 3 or 4 months someone comes in and tells you about some brilliant device. I always follow things up. I followed this up and spoke to the gentleman concerned, who was Jeffrey Edwards. I trialled the machine in my clinic, and the results were totally staggering. I've been to Prague, I've been to China, I've been all over the world looking at ways of healing and the benefits of recovery and all sorts of different facets of soft tissue medicine. and the results from the ECL were staggering.
I think the benefits we've seen as a basketball club, you have very few people missing training sessions or missing games due to injury, because they were able to use the ECL and get back on the court in a faster time than they normally would be able to.
I'm much more comfortable on the bike and ride for a long distance without any pain.
I couldn't imagine my life without the ECL. This was my best friend next to my husband, and it's like it's a part of your life.
I used the OA and the shoulder card on my shoulders and was able to save myself surgery.
ECL works through a process we call biomimetics. In other words, we are mimicking a natural biological signal. What GEM has been able to do is been able to decode and mimic the beneficial patterns which encourage the regrowth and the stimulation of new cartilage material, but in the absence of the corresponding wear and tear. Now, what ECL does is it tricks the body into assuming it's being aggressively exercised, which turns on the beneficial growth and rehabilitation processes, but it does this artificially rather than physically, and thus we're able to avoid a corresponding wear and tear.